first night of internship at UCLA was a busy night. There were patients already waiting to be admitted. And one of the patients had a complicated metabolic disorder that I had never actually cared for before independently. And the charge nurse on that unit at UCLA really helped me to get through that first night. And so to be open to mentorship, not only from the usual suspects, which of course are very important, but to be open to mentors coming from all kinds of different fields, and not to be hierarchical in our thinking. People who we think we are, quote unquote, in charge of, can teach us a lot.
This is Dr. Chethan Sathya. Thank you for joining us for this episode of Northwell Health's 20-Minute Health Talk. Today we have a really special guest. Dr. David Skorton, the President and CEO of the AAMC, which is the Association of American Medical Colleges, is here to join us today. Dr. Skorton, thank you so much for being with us.
Dr. Sathya, it's an honor, and congratulations on all the things that are going on at Northwell, and congratulations on this fascinating podcast.
Thank you. Thank you. I know we've had the chance to do a little work around firearm injury prevention in the past, and I've been really inspired by your leadership at the AAMC and how you all want to take on a lot of our toughest issues.
Well, this sounds like a mutual admiration society, but you know, there's no question about it. The real work of academic medicine goes on at our member institutions like Northwell, like medical schools all around the country, and academic health systems, teaching hospitals, and the academic societies. So please know this is sincere. We follow what you all are doing, and you're doing a lot of important leadership. You yourself, Dr. Sathya, and the entire organization.
We appreciate that. You know, it's a team sport, so we certainly learn from what you all are doing. So, you know, you've had such an incredible career, to say the least. I know I personally, and many of us, really look up to the many different hats you've worn throughout the years. I want listeners to get an idea about your personal journey. So you started off as a cardiologist, correct?
Let me take you back to the very beginning.
Yeah, please.
And, of course, you can leave some of this on the cutting room floor. It's not of interest. So I was born in Milwaukee. My dad came over from Eastern Europe about 100 years ago by way of Cuba, actually.
Wow.
And I was born in Milwaukee, and then we moved to Los Angeles when I was around 8 years old. And I fell in love with the music scene in Los Angeles, and I was convinced that I could be a so-called session musician in Los Angeles. And the only thing that stopped me from doing that was a lack of sufficient talent. Except for that, I would have been a fabulous session musician. So that's what I really wanted to do. My people in my family in general didn't go to college, and I thought I don't have to go to college either. But my dad convinced me that that would be a better route, especially when I began to recognize that I was falling way short in the music universe. And so I did go to college, worked my way through college, selling shoes, playing in a rhythm and blues band in Chicago, and working in a research lab at Northwestern. Mm-hmm. And then obviously was very fortunate to get into medical school, and had a very hard time deciding which path to follow. And eventually opted for internal medicine, and then I practiced general internal medicine. I had the privilege of running a division for about 10 years at the University of Iowa, and then also had a very narrow subspecialty practice, which was the care of adolescents and young adults with congenital heart disease. Mm-hmm. As you well know, as a pediatric surgeon, the commonest birth defect, and because of the work of surgeons and anesthesiologists and others, that population of patients' survival has completely turned upside down. The year that I was born, over 80% of those people born with a heart defect, about 1% of live births, did not make it to adulthood, and now over 90% do.
Wow.
So I fell in love with that line of work, and so did some general internal medicine, and also this, and also I worked in the veterans system and headed up an echocardiography lab at the Iowa City VA Medical Center.
Wow. You know, it's amazing to have these conversations because you learn so much about, you know, where folks kind of came from. Did you know when you were a practicing physician that you wanted to do more, right? You know, and we're going to talk about different elements of the various hats you've held over the years. But was that obvious to you when you were going through your initial job, even medical school? Was that something that you were thinking of?
No, and I suppose I should be telling you this was a well laid out linear path that I planned from my childhood, but it wasn't that way at all. I was doing research with some people who I was learning from all the time from the engineering school at the University of Iowa, where we were doing computer processing of cardiovascular imagery. And I had an appointment, a courtesy appointment in the College of Engineering and in the medical school. And they gave me the privilege of being the vice president for research for the University of Iowa. And I did that for over a decade. And then because I was working directly with the then president of the University of Iowa, I became interested in university-wide administration, and then became the next the president of the University of Iowa after Dr. Mary Sue Coleman. And I never was a department head, never was a dean, just went from the faculty ranks and from being a division director of general internal medicine to this research post at the university to becoming university president.
Love that.
And so that was just a very, very good fortune, and I mean that quite sincerely. And then Cornell University was looking for someone. I guess they were thinking someone who had already had some experience as a college president. And I had a very, very wonderful 9 years of learning from fabulous people at Cornell, both on the Ithaca campus, throughout upstate New York as the land grant school for New York State, and then also in New York City. And then from then I had the enormous, great good fortune to be considered to be Secretary of the Smithsonian.
Yes.
And I have no history working in museums, and mainly learned, no false modesty, but mainly learned from the people there who to this day, in my view, are the best of the best. From the leadership on through the museum directors, research library directors, those who run the educational programs, the National Zoo, just a wonderful, wonderful institution. And I learned all the way through and got to work with some astounding people. And I would have stayed there a long time, but I missed healthcare and I missed health education. And so was very fortunate to be able to come to the AAMC. I had been on their board for a few years, starting in 2010, and then had a chance to come here, as it worked out, just before COVID struck. And so I was happy to be able to be a part of, if you will, organized medicine during such a very, very important time. So this was a nonlinear path. And the only advice I guess I would give to your listeners and viewers is not to reject an opportunity that comes up just because it doesn't seem to be along an obvious pathway that others have walked, to be open to opportunities. And you never know what can come of those opportunities.
That's such sound advice. You know, I know a couple of my mentors have said very similar things in the past, right? And also don't say no to an opportunity that hasn't come yet. I mean, you know, sometimes we say no, I think, to things that we think might not be right, even before that opportunity is actually solidified for us to know what it is.
Yeah,
and you don't know.
Beautifully put.
Yeah, I agree. And I'm sure you didn't know what circumstances were going to be happening around your career when you made that jump from a physician, division head, to that research head, to president, right? Those circumstances change. Was there, you know, a individual or a group of individuals that you felt really gave you that initial opportunity, that shot, you know, and if so, how did you find those mentors in Iowa that said, hey, listen, I'm going to give this person who might not have gone through the traditional path, right, chair, dean, but I'm going to give them a shot because I believe in what they're doing? Was it hard work? Was it relationships? Was it all of it? What do you think?
Well, how many hours do you have for the podcast? I have a long story to tell about mentors. So I was at UCLA for my graduate medical education internship, medical residency, cardiology fellowship, and I had the good fortune to be the chief medical resident at the Center for the Health Sciences at UCLA. And Dr. Ken Shine was a very early mentor. Dr. Joseph Perloff, who was one of the pioneers in the field of congenital heart disease in adults, they were important mentors. But I have to tell you, some of my mentors came from unexpected places, and I'm going to tell you a real quick vignette. I know I'm very talkative, but I'll make this quick as I can. My first night of internship at UCLA was a busy night. There were patients already waiting to be admitted. And one of the patients had a complicated metabolic disorder that I had never actually cared for before independently. And the charge nurse on that unit at UCLA really helped me to get through that first night by talking me through it, helping me to put the right orders on paper in those days in a better way than I guarantee you, way better than I would have done on my own. And she ended up being a very important mentor to me. And I never would have said, well, I'm going to look to charge nurses to be mentors, but she was an important mentor. And so to be open to mentorship, not only from the usual suspects, which of course are very important, but to be open to mentors coming from all kinds of different fields, and not to be hierarchical in our thinking. People who we think we are quote unquote in charge of can teach us a lot.
Oh, absolutely.
And I like the concept that Shunryu Suzuki, Zen Buddhist monk, had a beginner's mind. And the phrase from that book, Beginner's Mind, was something like, in the beginner's mind, there are many possibilities. In the expert's mind, there are few. That's a paraphrase. So to be open to possibilities and not be so sure to eliminate some, that's a lesson that I learned from that nurse and from that first experience.
Powerful words. Powerful words. And so let me ask you the switch of that, the opposite of that question then. Folks commonly also speak about, right? You had to have courage and take risks to make these changes in your career as well. And I'm sure, I'm going to make the assumption that not all your mentors might have agreed with what you were doing, or maybe you didn't take all of their advice. So what do you say to folks, right? This is a common issue. I would say in academia in particular, we have mentors that have sometimes a set way of thinking. This is the way to do something. And you have to take it, and sometimes you have to leave it. And was that an experience that you had as well?
Yeah, it sure was, Dr. Sathya. It was. And it's hard to know. One doesn't want to ignore a mentor. And by the same token, it's one of many inputs. And so listening to the mentor, very important. Listening to your own heart, very important. Listening to your family and friends, very, very important. And somehow putting all of that together in some recipe and coming up with the right dish at the end is something that I could never advise another person how to do or what to do, except to be open to varying inputs. And again, as you said, not to ignore something or decide right from the beginning or before it even happens, well, there's no way I would do X or Y. To be open, to have a beginner's mind, and to be open to what may come forward. And by the way, that means being open to make a change if it doesn't actually work out. There's no problem making a decision that you want to change later. You have one time through this life, and I think it's important for all of us to forgive ourselves if we do make some decisions that we decide later we want to reconsider.
Yep. Couldn't agree more. So before we get into we have we could speak for hours, right? There's so many different things we want to talk about here. I do have to ask you, for the Smithsonian Institute, just for listeners, I mean, that jump from being a hospital, university president, being in healthcare, and then going to the Smithsonian, are those opportunities that, they are looking for healthcare workers and public health researchers and leaders to get involved with? I mean, what would you say about that?
Well, I would never speak for a magnificent institution like the Smithsonian. In my case, I think, emphasis on think, I'm certainly not sure. They were looking for someone who had some appreciation, perhaps a modest background in the arts, interested in the humanities, and had a scientific background, because the Smithsonian, in addition to the wonderful, amazing work that it does in history, and culture, and so on, is huge in science as well. Many people don't think about it in that way, but it is. And so again, I can't tell you why they considered me, but I don't think it was specifically because of healthcare. I think it was perhaps because of some balance or some interest in both the arts and humanities on the one hand and science on the other. And I do have to say, quite separate of the Smithsonian, I do think that there is an enormous place for the arts and humanities in medical education. We have a fabulous colleague at the AAMC, Dr. Lisa Howley, who heads up an initiative we have. The acronym is FRAME, F-R-A-H-M-E, the fundamental role of the arts and humanities in medical education. And I urge your listeners and viewers, if they are so interested, to go on our website, aamc.org, and look up FRAME, Fundamental Role of the Arts and Humanities in Medical Education, and see a lot of fascinating data and what I think are really terrific ideas that Dr. Howley and her colleagues have come up with to think about the role of non-science areas in the world of health science. It's to me, quite convincing.
Yeah, and I'm sure speaks to the power of cross-sector collaborations, right?
Yeah.
We can't work in these silos, and I know some of the work you've done has spanned those types of collaborations. So we'll definitely share the link to that program, the FRAME program, to our listeners as well.
Yeah, thank you so much. To be humble, to be sure that you're not too sure about your own opinion, and to be willing to listen to other people and to be open to their points of view is unbelievably important. And as you mentioned, we want to be open to new evidence, and that's all part of the same mentality to me, and that is to be constantly learning, to have that beginner's mind, and to have that humility.
So, you've been involved with medical education now for a long time, and things have changed, right? We know that we're at a very unique time when it comes to the way that patients, the public, consume medical information, the way that even physicians learn, whether we're talking about AI, ChatGPT, social media. Mistrust in healthcare is at a high. We are struggling with that across public health as well. I guess I would ask you, just to kick us off, how are you thinking about medical education in the context of those two major changes that are happening: information ingestion and trust?
Yeah, thank you. What a very, very important question. Well, first of all, I want to make sure that your listeners and viewers understand that I'm no big expert on artificial intelligence or most emerging technologies. I'm not. But I'm an observer of the scene and a consumer of it, if you will. And so medical education, I think, has a very important role in preparing students, medical students, to use AI or other emerging technologies that we didn't have even a few short years ago. Not that people weren't working on AI more than a few short years ago, but that we didn't really have in our day-to-day lives. And of course, we have to keep pace ourselves with the changes and ensure that tomorrow's doctors, so to speak, are prepared to responsibly integrate these technologies like AI, but not limited to AI, to integrate them into their practice. And the clinical setting, as you know, has already changed with tools like ambient listening and so on. And we have a unique opportunity as a community, all of us, you and I and all of us, to shape how we interact with these technologies and effectively leverage them for our patients. We're not doing this for ourselves. We're doing it for those we serve, the patients, the families, the communities. So we're committed to supporting and leading the advancement of AI in academic medicine at this critical moment. And I like to refer people to people who know more than I do. And another one in our organization is our Chief Academic Officer, Dr. Allison Whalen. Mm-hmm. And she's doing a lot of work to try to gather important resources regarding AI and to make them available for our broad academic medicine community. So there's a webinar series available called Including AI in Academic Medicine, and anyone can freely register on our website. And we have curated collections of scholarship, research, and resources that anyone in the community can access and share as we realize the difficulty in keeping up to date on this fast-moving field. I wouldn't speak for you, Dr. Sathya, but for me, keeping up is exceedingly difficult. And then in terms of your second question, perhaps one of the most important questions about any field in our current world is helping students learn skills to build trust. And as you know, and it's why you wisely brought it up, wisely in my view, we're witnessing a steady erosion of trust and need to do a much better job of listening to each other based on the idea that the other person might have something to teach us and not be immediately sure that everything that comes out of their mouth is going to be wrong or not worth us listening. Even with those better skills of listening, we need to find better ways to actually earn people's trust. We can't just declare you or you should trust us. We have to earn it. And building trust is complex, and I sure don't have all the answers, that's for sure. But in part, I believe it involves learning to listen with respect, learning to listen with humility, and recognizing that much of the greatest wisdom comes from the community. If you want to solve a problem, don't forget to ask the people experiencing or suffering that problem. And the AAMC Center for Health Justice produced something called the Principles of Trustworthiness Toolkit. And if you would be so good, you could also perhaps include a link to that for your audience. And this has conversational guides and practical tools that organizations, any kind of organization, can use to become actually more trustworthy partners. So we have a long way to go and a long series of things to learn from each other.
I love that response, David. For both the first and second part, I'm going to just have some follow-ups on each. So just for the second part around trust, I couldn't agree more. I think empathy, open listening, and not being overly dogmatic are very important. And if I'm going to be honest, I don't think that as a profession we've done a very good job with that. Often there are physicians, healthcare workers, right, myself included, in the past, who can say, "Listen, we know what's best," or maybe look down upon somebody who might have an alternate opinion. But the more and more I have these conversations, I agree with you, with unlikely allies or people that I would think I would disagree with, I actually learn quite a bit, start to understand their point of view. And they actually teach me areas that I was wrong about. And again, we're always going to stick with evidence-based strategies here, right? Let the data lead, let the evidence lead. But how do you build that trust is absolutely essential. Are you optimistic about that?
Well, first of all, permit me to say that the way you asked the question and stated it is the best possible answer. To be humble, to be sure that you're not too sure about your own opinion, and to be willing to listen to other people and to be open to their points of view is unbelievably important. And as you mentioned, we want to be open to new evidence. And that's all part of the same mentality to me, and that is to be constantly learning, to have that beginner's mind, and to have that humility. So I could never improve on the way you stated it. I think that's exactly right. Even with all that, trust is hard to gain.
Yeah.
And it's hard to gain partly because we've made mistakes, or I should say I've made mistakes. I certainly have in the past.
Same.
And to be able to admit an error and to say, let's go from where we are now, I think that's important. To forgive ourselves for making errors and to move forward. It's important. You're not asking me this, but I'll say in life in general, as well as in education, as well as in medicine. So you stated it just right, Dr. Sathya.
Yeah. No, you're absolutely right. I mean, and being able to communicate uncertainty. I don't think that, I personally wasn't trained very well in being able to do that.
Yep.
And, I was fortunate to have some journalism training. That's where I started to really want to have these conversations openly and start to get those alternate viewpoints. And it's fascinating because I think the more I learn about this, I don't know if you agree, but questioning dogma is not a bad thing. Invalidating evidence is, right? But I don't think they go hand in hand. I think you can question things and look for new solutions and understand if things are, replicated in studies, for example, while still not delegitimizing the great evidence that's out there. And, we have to be careful, right? We can't have one study rise to the level of 100 meta-analyses, of course. But I do think, we have to get away from that fear.
Yeah, I agree with you. It's a judgment call, right? It's not something you can necessarily weigh or measure.
Yeah.
And I do think that there's a risk, a very big risk, in throwing out evidence that's been developed over a long period of time and has been confirmed and restated again and again and again. And yet, having said that, it is important to be open. And those of us who have done research, or people like you that are still doing it, are constantly asking questions.
Yep.
And the only way to be able to ask a question openly is to not be sure that one has all the answers. Mm-hmm. But the balance that you're talking about, not to throw out evidence that has stood the test of time, is very, very important as well. And I wish I could give your listeners and viewers a little formula for how to do that. There is no formula that I know about.
Yep.
But I think listening to each other is a very good start, being open to other points of view, and having the courage to stand up for what one thinks after that careful openness and analysis has occurred. And as you're suggesting, I believe, Dr. Sathya, to widen the circle of people to whom we are willing to listen and talk.
Absolutely. Absolutely. And going back to the first part of that question, I think technology is going to play a big part of this. Yeah. Right? The consumer, the patient, the community is only getting more and more information. I mean,
and that causes us to have a much different point of view of our role as a physician. And by the way, I see healthcare as I believe you will as well. I'll be presumptuous. As a team sport.
Yeah, absolutely.
That docs don't have all the answers, and we need to link up with other health professions. Because we're all looking at a complex series of problems. Few things that I know about are more complex than healthcare. And so I think opening up that circle to all of our colleagues in the other health professions is absolutely critical. And that's an important thing that we're also doing at the AAMC is working with other health professions.
Yeah, we are totally aligned on that, absolutely. And also your prior point about bringing in other sectors, humanities, the business sector. I think, I'm always thinking, how are medical students and our future doctors learning about that? Because I do think from a policy standpoint, from a public health standpoint, that's critical. You have to weigh decisions, public health decisions that impact the population with also economic considerations.
You bet.
Right?
You bet. And the better we do with what you're suggesting, and the more we can face those realities squarely, perhaps we can do better in terms of the value that we're giving for the very, very large cost of healthcare.
Yes, certainly. So on the technology side, are you hearing more and more from students, for example, faculty, physicians, a concern about job loss, or that their careers are fundamentally going to change, specialty decisions? What are you hearing?
All the above, and many other concerns. You're asking someone at the other side of the professional life cycle, so to speak, what I think about it. I've seen a lot of technologies. AI, I believe, is fundamentally different than some of these technologies that I've seen, communications technologies and so on, in my time. But I would say the chance to be open to what might occur while being careful that we have, for lack of a better term, guardrails around the use of the new technologies, and being careful to make sure that we don't too quickly adopt the technologies when we ought to be working with the technology. That's the way a lot of us are approaching this. And integration of, in terms of medical education for just a moment, formal medical education, integration of these rapidly emerging technologies requires, redesign of the curriculum, right? And faculty development. The faculty have to be up to speed. And also new methods of assessing the curriculum. And these are resource intensive and represent a significant transformation of all education, including but not limited to medical education. And so the med schools have to ensure not only are we thinking about this from the learner's point of view, but that the faculty have adequate training and adequate time to teach new competencies and develop methods that will allow us to embed these technologies responsibly. We have published, again, this is Dr. Whalen's work, published some AI competencies for medical educators. With wonderful support from the Josiah Mason Jr. Foundation, we'll be developing AI competencies really across the whole curriculum. And the goal of all this is to ensure that learners all across the curriculum receive essential training in the fundamentals, including those ethical and legal considerations.
That's critical. I mean, it's rapidly upon us that age. So, really happy to hear that. So do you think that translates then also into a very big change in how we think about medical schools actually selecting students? And I say that in the sense of, we focused, of course, on exam scores, other metrics, prior achievements, leadership abilities, and so on. Are there considerations now? Okay, because I'm making the assumption that it's going to become increasingly important that future physicians are empathetic, have a high EQ, are able to really focus on a human-centered approach, right? Just thinking about the skills that AI is not going to take away for quite some time, if ever. How is that changing the admission process, if at all?
Well, I want to be very, very clear at the beginning of this answer, Dr. Sathya.
Yes.
I don't know is the most honest answer in 3 words, and I want to be very clear about that. As we are thinking this through, we're thinking it through the eyes of our colleagues at each medical school who make their own decisions about curriculum, make their own decisions about admissions, and so on. And as someone who's been in higher education as a faculty member since January of 1980, I will tell you that I still believe in the importance of the flexibility of individual institutions and their faculty to make their own decisions in this regard. So the last thing the AAMC is going to do, at least while I'm in it, is to dictate to our institutions how they ought to be thinking about medical admissions and so on. But for a long time, the way the field has been moving is to go beyond any simple metric like grade point average or medical college admission test score and look at a wide variety of factors for just the reasons that you're saying. And this long preceded AI. And so it remains to be seen exactly how that will all shake out. But the idea that we have to think broadly about the skills that are necessary, obviously, having a grasp of science is critically important, but that's not the whole story. I'll give you an example from the arts. You're probably familiar, many years ago, there was a study done with medical students at one of the medical schools that gave them some experience learning how to do close looking at art at a prominent art museum in the city where that medical school is. And the students who had been through that ended up having some better observational skills when assessing patients. And that, when I first read about that some years ago, I thought, well, that's really something. It wouldn't have been intuitive to me.
Yeah.
And that might not be the sort of thing that you would have thought about, at least when I was applying to medical school, which was a very, very long time ago. And so I think it's important that we are open and that we recognize that as time goes on, not just from technology, but as time goes on, we will continue to evolve our thinking about medical education, healthcare, and therefore backing it up, continue to evolve our thinking about how we choose those to go into the field. And again, I refer to the wonderful work that's being done at the AAMC, again through our academic affairs, Dr. Whalen and her many colleagues, to think carefully, along with the deans and along with the senior associate deans for medical education, other leaders in every one of the medical schools, to think about this very question you're asking.
No, and you know, I think it's such a complicated environment. You know, so many different medical schools. I know, and that's kind of the beauty of it. To your point, you know, everyone has that flexibility to be able to innovate on the curriculum. And I mean, medical education has changed for the better in so many ways over the last 10, 20 years. It's really incredible, even from when I was in medical school.
Well, when I applied to med school, many of the bodily organs hadn't been discovered yet. We didn't really understand all about those things. And books were not invented till my third year of med school. So it was much easier in those days.
We only have one more question left, probably just in the interest of time. So Dr. Skorton, if you were to look back, right, on the incredible evolution of medical education, again, enhanced education, it's really incredible what medical schools have done across the country in many different capacities. What do you think, looking back, we've gotten wrong, and what have we gotten right?
Very interesting question. Let me start with what we've gotten right, because I think the things we've gotten right greatly outnumber those other factors. And that's not a sales pitch. That's an honest observation from someone who's been in the field for a very long time, half a century. And I would say that the doctors coming out of medical schools overall are enormously well equipped to understand the problems their patients are facing, and their families are facing, and their communities are facing, to understand how to analyze those problems and what to do about them. So overall, I think the field has produced some enormously effective physicians. Why do I say that? Not only is it based on sort of narrow things like the measurements on examinations and licensing exams and so on, which continue to be quite high, but because of my own experience and experience of others who I've talked to as friends or just acquaintances with their interactions with the medical system, that very, very, very much the majority feel that they have been helped in American medicine. However, there are some areas where we need to do better. The cost of healthcare, obviously we've been talking about this for decades, is high in the United States. We have to focus on the social determinants of health so that all of the things that need to be done to give someone the chance of a healthy, fulfilling life cannot all be subsumed in the examining room or in the walls of the hospital or clinic. We have to be very careful to think about social determinants of health and be willing to act on them. And you yourself have worked in that field, Dr. Sathya, and Northwell actually has worked very importantly in some aspects of social determinants of health. And so I think that we need to constantly do better in that regard, constantly remember the importance of the beginner's mind, and constantly understand that we go farther if we don't rest on our laurels, if we don't pat ourselves on the back too much, but talk about how could we improve things further, and make that decision in part by listening to each other, in part by listening to our patients, in part by listening to those we don't always listen to, and in part by listening directly to our communities. So it's a balance. I think overall we've done a very good job, but we have a long, long way to go. We have a lot of problems, as you know, with non-communicable chronic diseases. And by the way, still infectious diseases, communicable diseases are still a challenge in our world.
Yep.
And so I think we will never be out of challenges, but I think we have a long way to go. But also I think we've done a lot of good work along the way. And as you mentioned earlier, Dr. Sathya, finding that balance where we are not claiming that everything is just right as it is, and not claiming that everything is just wrong as it is, but having an open-minded point of view in our own hearts and with those we listen to is our very best bet moving forward.
I love it. Love it. Thank you so much, Dr. Skorton, for being here, for your incredible leadership at the AAMC, and for all the leaders you mentioned at the AAMC, and all those deans and medical student leaders across the country that are working hard to prepare our next, young generation of physicians. We really do thank you.
And please do me a favor, Dr. Sathya.
Yeah.
Look yourself in the mirror, congratulate yourself, and congratulate all my colleagues and friends at Northwell about the great job they're doing day in and day out. And thank you for having me sharing in this wonderful podcast. Have a great day.
I will. Thank you. Thank you for tuning in for this episode of Northwell Health's 20-Minute Health Talk. We will be sure to include some of the links from this episode that Dr. Skorton mentioned in the bio. Thank you.